That's alright, you're alright. He just
You don't want to ever put your child in this kind of dangerous, compromising position or situation. This sudden impact from this headbutt on this child can lead to a cardiac arrest, which means this child's heart can stop, and obviously the child could die. And why would that happen? There's something called Commotio cordis. So a sudden force, a sudden blow and impact to the chest, especially young people, teenagers, adolescents, children, and even infants, can lead to cardiac arrest. What happens is that when that force strikes the heart, depending on the phase of the electrical activity in that heart, the heart can go into a very irregular, life-threatening irregular rhythm we call ventricular fibrillation. And that child will collapse, will not have a pulse. The heart essentially will stop beating. It will go into a phase like a shock. The heart will be shocked, and then that could lead to the child losing their life. So you don't want to ever put your child in this kind of situation. Commotio cordis can happen in people who play, children who play baseball, baseball, hockey. When there's a sudden strike to the chest, it can really distort their heart activity. And the reason why it's more common in younger people like children compared to adults is because the chest wall of a child is still very compliant. The elasticity, the elastic recoil of the chest wall of a child is still very high. Remember, children are still growing. The cartilages and bones and the joints, the bones around the joints have not fully, what we call ossified, if not fully matured and solidified. So there's a lot of movements that happens in the chest wall of a child. So any sudden force can get transmitted directly to the heart and can actually lead to the death of the child. So this child that has been head-butted, the right thing to do is for this child to seek emergency services, to be taken to the A&E, properly assessed and observed, and have an ECG of the heart, a tracing of the heart to make sure they're not having an arrhythmia, any form of arrhythmia. Observe this child for a couple of hours, and then send them home. And obviously the parents will have to keep a close eye on that child for 24 hours in case there are any changes that they observe. They'll have to take this child back to the hospital or call an ambulance. So it's a very serious thing. It's not something to be joked with. Don't put your child in such a position, please.